Did mom or dad suddenly stop walking? Hi, I'm Debbie Callender. I'm a physiotherapist and dementia care specialist. This is Dementia Caribbean, where we make brain health practical for our region. In dementia, movement can slow down because of pain, fear, or brain processing changes. The good news is that small tweaks often can make a big difference. In this clip, we're going to look at 3 common reasons that walking might stop and a quick fix for each one so that you can start turning this around today. Please note that the person that you're going to try this with should have been cleared by a medical doctor in terms of their ability to walk before you try any of these interventions. So let's look at cause number 1, pain or stiffness. Pain can hide in ankles, hips, or in the lower back, and the solution is often gentle movement to help to restore flexibility and comfort. On this slide, there are 3 gentle exercises that can be done for 60 to 90 seconds for gentle warm-up. If pain increases or there's swelling or redness after these exercises, call your general practitioner. Cause number 2, fear of falling. One slip can make anyone hold back. The fix for this is to make sure that when the person is walking, there is a clear path, that they have a sturdy stronghold. This can be a countertop or an installed hallway rail. And we want to practice along with them, counting 1, 2, 3 step with you standing on the stronger side. When we're doing this practice, we want to make sure that the person we're working with has on proper footwear. We want shoes with a good grip and that are secure around the ankle. No loose slippers and no shoes with smooth soles. Cause number 3, visual or perception changes. The brain may begin to misread floors and thresholds. To fix this, we can use contrast tape along the safe path that we want them to use. We can remove rugs that have busy patterns, and we can add night lights to ensure gentle lighting along walking routes. Here's a simple mini routine to try to restart walking. First, have the person warm up for around 2 minutes. Gentle ankle pumps and the exercises that we spoke about on the earlier slide should be useful here. Then, we want to make sure that we've prepared the area for them to walk. The area should have rails or some kind of handhold that is sturdy. If we have a transfer belt, we should put it on at this point, and we should make sure that our physical presence is near to the person in case they require support suddenly. A nearby seat is also useful in case they get tired before they're able to finish the 10 steps. Once all of that is set up, encourage the person to take 10 careful steps with you beside them. Do not stand in front of the person. Once that's been completed to the best of their ability, we want to rest and celebrate whatever gain they made today with a smile and with positive words. We want to try to progress this routine gradually, adding 2 more steps every 2 to 3 days if it's safe and the person feels comfortable. Here are 3 mistakes we want to avoid when trying to restart walking. Firstly, we never want to pull the person by their arms. This potentially can cause injury, and it can also increase fear in the person. We want to support from the side, and we want to use proper handholds against the wall or using a counter or a very sturdy table. Secondly, we don't want to rush the process. We have to have patience while the person builds confidence. If we try to rush, it's going to create anxiety and it actually will increase the risk of a fall. And thirdly, we don't want to walk when conditions are poor. Let's not attempt walking when the person is feeling dizzy or unwell, in spaces that are poorly lit, or on surfaces that are not stable. Start today. Identify which causes you think apply. Try the specific fix. Remember to begin with 2-minute warm-ups and practice the 10-step routine. Also, track your progress. Note the daily walking distance or how many steps they took. Monitor how comfortable they're feeling. Celebrate every win and adjust the pace as is appropriate for the person that you're dealing with. Remember, We just want to take 60 to 90 seconds daily warm up, 10 steps if we can, and progress every 2 to 3 days. Join the Dementia Caribbean school community to download the Walk Again checklist in the free tier of the community for quick reference. The paid tiers of the community will have a more complete guide, expert question and answer sessions around the topic, and other courses that take a deeper look at fall prevention and safety. Remember, small changes can make a big difference. You've got this, and we're here to help every step of the way. The links to join the community are in the description below this video.